The broadcast is now starting. All attendees are in listen-only mode.
Well, good evening and welcome to another edition of Question Lab. I am your host tonight, Jeff Downing, and tonight we're going to lead you through a sequence of questions pertaining to GI, gastrointestinal. So we're going to have a good set of questions in here to test your knowledge about this subject and help you prepare for upcoming exams. And for those of you getting ready for step one, this will be a good session for you. As always, we are graced by the presence of Dr. Paris Vicaria. Paris, would you like to introduce yourself to the crowd?
Absolutely, Jeff. Hey guys, my name is Paris. I'm currently working in dermatology and I'm also an RX coach with USMLE-Rx. So I work one-on-one with students such as you guys to help prepare you all for the USMLE Step 1, as well as the Step 2 CK as well. And I'm happy to help lead tonight's session on GI.
We're going to talk a little bit about RX Coach later on in the evening, but I want you to know that the methodology that we use during Question Lab is quite similar to the methods used by our coaches when working with students. So the main thing that we stress is that success on the boards isn't just about knowing the content. That's a big piece. It's an important piece, but you also need to know, how to prepare, how to study, and how to work through these questions. Because as you'll see, board style questions. There's a lot that you need to, there's a lot to parse, and it's important that you have a standard route that you use in order to answer these questions. So we'll be sharing some of those tips during tonight's event. So here we go. Let's go ahead and get it started with question number 1. So first thing, when we reveal the questions, you'll see that there's something missing. So you don't see the answer choices. So that's really step 1 for us. When you're going through this, we ask you to cover up the answer choices. Why would you do that? You might ask. Well, part of it is that in the answer choices, in those distractors, you may see terms that you're unfamiliar with, or you may see concepts that you feel a little shaky on. There's all kinds of different ways in which you can get rattled, right? And so we feel like it's good to start off by just covering up those answer choices, and then we ask you to read the actual lead-in, which is the question part of the QID. So in this case, the lead-in is assuming this patient is in the window period of infection, which of the following serologic markers is most likely to be positive? Okay, so that's what we ask you to do next. Once you've looked at the lead-in, now you have a sense of what it is that the question might be looking for. You know what the question is, and now there's the data that will be contained within the vignette that will kind of help guide you. Okay, so with that, we say go ahead and read the vignette, and we'll do that right now. A 26-year-old woman presents to the clinic for follow-up evaluation. She was diagnosed with hepatitis B approximately 4 months ago. The patient has no complaints, and physical examination reveals no abnormalities. Laboratory studies are ordered. So again, the lead-in, assuming this patient is in the window period of infection, which of the following serologic markers is most likely to be positive? And what I'd like you to do is kind of think about how many steps you think it will take to answer this question. And I'll let Paris talk about the difference between a step 1 or a 1-step question versus a 2 or 3-step question as I turn it over to him. Paris?
Thank you, Jeff. So what we're going to do is we're first going to show you what we think are those important clues in the vignette and the lead-in, okay? So generally with the question, one of the first things you're going to get are demographic information. In this case, we're told it's a 26-year-old woman. So you want to make note of that because automatically that can start to cut things off your differential, make you start to think of certain things. Now in this case, we kind of know what the question is asking as we had read that lead in first. So you want to make sure that you're picking up on those clues in the vignette that could potentially tie into that question. So, she was diagnosed with hepatitis B 4 months ago. We're told that she doesn't have any complaints or any abnormalities on exam. So then the lead-in is asking us, if we're saying that this patient is in the window period of infection, what serologic marker is most likely to be positive? Okay, so I think we've got a couple steps here. And actually, you could even make the argument that this is kind of a one-step question, that in the window phase of infection, window period of infection, what serologic marker is positive, or which ones are positive? Okay, so this might just be a one-step question, depending on how they decide to phrase the answer choices. So let's go ahead and let's take a look at those answer choices. And when we work with students, when we go through the answer choices, we actually recommend that you start at the bottom, answer choice E, and work your way up to the top, answer choice A. And the reason we do this is because a lot of times we'll see students who start at the top, they'll see something they like and they'll select it without going through all the answer choices. So sometimes they'll get that question wrong. So we recommend doing it this way to prevent yourself from biasing yourself and to not make that mistake. So let's go ahead and let's do that now. Answer choice E, hepatitis B surface antigen. D, hepatitis B surface antibody. C, hepatitis B E antigen. B, hepatitis B core antigen. And A, hepatitis B core antibody. So we're going to go ahead and open up that poll. Go ahead and select what you think is the best answer here, and we'll talk about it in just a few seconds.
Okay, fantastic. Thank you, Paris. So the poll has been launched. So again, take a look at that. What do you think is most likely to be positive here amongst the serologic markers here? This is the kind of question we typically cover this in question lab when we do gastro. So some of you regulars may be familiar with this or familiar with the topic, but it is one that we find to be important, and it's one that's easy to confuse. So let's see, we've got about almost 3/4 of you have voted, so we're going to go ahead, get ready to close the poll, and let's share the results here. So we've got kind of a, it's sort of a 3-horse race here. Hepatitis B core antibody with, in the lead, answer choice B right behind it, and then about a little over 1 out of 5 of you chose hepatitis B surface antigen. So let's go ahead and hide those results. Keep those in mind as we reveal the answer. And the answer to question number 1 is answer choice A, hepatitis B core antibody. And the group got it right tonight. So nice job, everybody. For those of you who might have missed it, that's okay. We are here to get you on the right path. So Pars, take it away.
Thank you, Jeff. So let's go ahead and let's talk about this. Like Jeff was saying, this is an important topic, okay? So if we are to assume that this patient, this 26-year-old woman, is in the window period of hepatitis B infection, what does that mean? That is basically the period between when your hep B surface antigen disappears and when your surface antibody appears, okay? So let's take a look at the next slide, and I'll repeat that again. So hopefully that will start to make a little bit more sense as we take a look at this next slide. And you can see there that small little window period, okay? And basically that window period is when your surface antigen of the virus is starting to disappear because you are making antibody against it. And the appearance in terms of when it is detected, the level of detection, when the surface antibody is now detectable. So in that window period, you do not have detectable surface antigen and you do not have detectable surface antibody. Okay, so the only thing positive, as you can see there from that pink-purple curve at the very top, is an anti-HBC, or your antibody against the core antigen. Okay, so your hepatitis B core antibody is the only thing, or sorry, one of the only things that is positive in the window period. Of the answer choices, that was the only one that was positive. Okay, you would also have an antibody against the E antigen as well. So you have antibodies against the core antigen and the E antigen. Those are the only things present in the window period. So if we take a look again at the next slide, if we go one slide further, there's also a really nice table in first aid that kind of puts this more in a table format. You can see there in the window period, the only two things that are positive are your antibodies against the core and antibodies against the E. Okay? Your surface antigen and your surface antibody are not positive or not detectable. So if we go back to our question and we take a look at the answer choices available, we could see that answer choice A is the only one that would be positive, antibody against the core. Like we said, your surface antigen and surface antibody are not detectable. That's the two cutoffs for the window. You would have an antibody against E antigen, but keep in mind that's not what they're asking us in C. They're saying just the antigen. And then answer choice B, Hep B core antigen. This would not be detectable in blood as well. So the best answer choice, like you guys as a group selected, was A.
Excellent. Thank you, Paris. Good breakdown there. Hope you guys appreciated the art from first aid to help kind of break this down. Again, this is one a topic we cover during almost every time we go through GI. So hope that that you've learned something here, something you can take away from tonight's event. Want to note that we, if you are looking for a study planner, we have a free one. This is our RX study planner, and it was originally designed by Dr. Arjun Iyer of Express Videos fame to help you get ready for step one. You can now download it and get the step 2 version. So we just added step 2 to the free RX study planner. So again, it's a great free tool. It's flexible and it will help you kind of organize your whether it's your dedicated period or the weeks leading up to one of your big exams, and also help you kind of organize your day and then show you your progress. Main thing we want to be able to do is help you focus on the areas where you need to invest more time. And that's what the study planner does well. So again, we've got the link there in the chat. Let's go to question number 2. And again, we are going to start with the lead-in. In this case, which of the following is the most likely cause of this patient's condition? Okay, so this is a very, textbook question that you're going to see on the boards. You see this all the time. So think about what kind of information you should be looking for as we go through the vignette. A 30-year-old man comes to the physician complaining of gnawing pain in his upper abdomen for the past 2 months. The pain decreases with meals, but worsens with consumption of spicy food. The patient has been taking a proton pump inhibitor for the last month without an improvement in symptoms. Esophagogastroduodenoscopy reveals multiple ulcers in the duodenum and 2 ulcers in the proximal jejunum. So again, the question, Which of the following is the most likely cause of this patient's condition? Let us know how many steps you think it will take to answer this one by going into the question box and letting us know as I turn it over to Paris.
Thank you, Jeff. So let's take a look at this question now. Okay, so now we've got a 30-year-old man. Okay, those are our demographics. And they tell us he's coming in because of gnawing pain in his upper abdomen. So that's what we call the presenting signs and symptoms. And it's important to make note of that because that's what brought him in to be seen. You don't want to forget that. A lot of times we forget that because it's the very first thing in the very first sentence, and we're given a lot more clues. So you don't want to lose track of that. And a lot of times they'll also tell you how long those symptoms have been going on for. In this case, they did. It's been going on for the past 2 months. So that gives us a sense of chronicity. This is a little bit more of a chronic issue rather than an acute issue, okay? Now, anytime you have abdominal pain, especially in the upper abdomen, questions that you want to ask the patient, what makes it better? What makes it worse? In this case, we're told some things that make it better and some things that make it worse. We're also told about medication. He's been taking a PPI, and it has not helped. And then we're also given some EGD findings. So you definitely want to make note of that. Now, this question is asking us the most likely cause of the condition this patient has. So I think we've got a nice two-step question here. I think one, we've got to use those clues to figure out what condition this patient has. And then two, know the mechanism or etiology behind that condition. So let's go ahead and let's take a look at these answer choices. And once again, we're going to start at the bottom and we're going to work our way up to the top. So answer choice E, pancreatic neoplasia. D, mucosal ischemia. C, medication adverse effect. B, Helicobacter pylori infection. And A, autoantibodies to parietal cells. So once again, we're going to go ahead and open up that poll. Go ahead and select what you think is the best answer here, and we'll talk about it in just a few seconds.
Excellent. Capital, let's go ahead and submit your answers. Again, you should never leave a question unanswered on test day. You're not going to be penalized for your any incorrect responses. So you should always answer something, and definitely want you to answer every question during Question Lab. And for those of you playing at home, yes, esophagogastroduodenoscopy is most likely the longest term that we've used here in Question Lab. So here we are in episode 121, Breaking Records. Let's see, almost 2/3 of you have voted. Let's go ahead and get ready to close this poll. Looks like we have a heavy favorite here. Okay, let's share the results. And so, yeah, almost getting close to 2/3 of you. 3/5 of you went with Helicobacter pylori infection. But about 25% of you went with pancreatic neoplasia. So let us see how we did. So let me hide those results and reveal the answer. And the answer to question 2 is answer choice E. So the second place choice, pancreatic neoplasia, was correct. So obviously something in this question misled quite a few of you. So let's turn it over to Pars to help break it down. Pars?
Thank you, Jeff. Yes, definitely a tough question here. So let's take a look at what's going on, okay? So this is a 30-year-old male, and we know he has ulcers, right? That EGD showed that he has ulcers, okay? However, the disease is resistant to PPIs, okay? A little unusual. On top of that, the ulcers are in a kind of non-characteristic area, okay? Having ulcers in the jejunum is pretty far from where we expect to normally see our peptic ulcers, which are usually in the gastric areas as well as the proximal duodenum. So having multiple ulcers in the duodenum and 2 ulcers in the proximal jejunum is a little bit more suggestive of something else going on, okay? And in this case, one of the things that you would want to worry about is Zollinger-Ellison syndrome, okay? This is when you have a neoplasm that secretes gastrin, and that causes more acid inside of your GI tract. So let's take a closer look at the next slide, a little bit in-depth look at Zollinger-Ellison. This is a gastrin-secreting tumor, and this causes acid hypersecretion that causes recurrent ulcers in the duodenum and the jejunum, okay? Now remember, this is a pancreatic neoplasm, so this could be associated with MEN, or multiple endocrine neoplasia 1, okay? So this is most likely the cause of this patient's condition. So if we go back to our question, we'll take a look at those other answer choices you selected, especially answer choice B. Make sure you understand why it's not that. Answer choice D, mucosal ischemia, that's more the etiology of curling ulcers, in which cutaneous burns lead to hypovolemia. Not what's going on here. Medication adverse effect, that was if the patient was using a lot of NSAIDs, which we're not told about. H. pylori infection, keep in mind, as we mentioned, that is a common cause of gastritis and ulcers in the gastric and duodenal region, but distal to the duodenum and the jejunum is an uncommon location for H. pylori infection. So that would not be consistent with this presentation. Lastly, answer choice A, that is more of an issue with chronic gastritis, and usually you find ulcers in the stomach, not in the distal locations like this as well. So that area of where the ulcers were was a very big clue to what was going on in this question.
Very good. Thank you, Para. So again, that was a tough one, but don't let it break your stride. We've got a couple more questions where you can recover. First off, though, I want to remind you about RX Coach. So again, depending on where you're at right now, you may be, looking at the beginning of the new school year, or you may be preparing to take step 1 in the coming weeks and months. Regardless of where you're at, we are here to help you at any stage of your journey, and we've been, helping med students now for over 3 years, helping them get ready for step 1, for step 2, for COMLEX, or even the CBSEs, right? There's all kinds of high stakes assessments that that med students end up having to take in med school, and we really want to make sure that we're doing everything we can to help you prepare. So part of the reason why we do Question Lab, right? We want to give you a chance to kind of sharpen your skills, but in some cases, students see, hey, I need personal attention. I need some one-on-one coaching, and that's why we're here. Part of our process is we start with a 160 question assessment, which that's basically a half-day simulation, right? And we use the results of that to see, hey, what are your strengths and weaknesses? Where are the areas in which you might want to focus more of your attention? It helps inform a personalized study plan that we work on with you. So again, it's important for you, for the student to agree. Yes, I struggle with GI, or I struggle with biochem. Whatever the case is, we want to be able to make sure that we've got a good read on where you're at. RX Coach is a one-on-one service. This isn't group tutoring. It's not virtual class tutoring. It is a relationship that you have with one coach. And we've got highly trained RX certified tutors. We've been in the business of helping students prepare for step one and for the boards for over 30 years now, and we've invested a lot of that knowledge into building out this program. And you do get complimentary access to our RX 360 Plus program, which includes RX Bricks. So if you're at that point where you're like, oh, you know what, I'm not where I need to be, or I'm not where I want to be, we've got the link there in the chat, rx-coach.com. You can go there, learn a little bit more about the program, and you can set up a free consult. And during that free consult, you can ask us questions about our methods and what we do. And if you find that it's a good fit, we'll pair you up with an experienced coach like Paris or Richard. Okay, so with that, let us get into the second half of tonight's event and head into question number 3. Okay, so everybody kind of go ahead and reset, and we'll get started. So we will, once again, we've got all of those answer choices covered up, and we're going to ask the lead-in. Which of the following initial tests is most likely to explain this patient's presentation? Okay, so right there, you know that we're talking about tests, trying to figure out what's going on with this particular patient. So let's read the vignette and learn what it's all about. A 40-year-old male comes to the office because of daily diarrhea over the past 5 months. During this time, his stools have smelled worse than they used to and appear oily. He has lost 9 kilograms over the past 5 months, despite having a good appetite. He is in recovery from alcohol use disorder and has had multiple bouts of acute pancreatitis in the past. Which of the following initial tests is most likely to explain this patient's presentation? Go ahead and head over to the question box and let us know how many steps you think it will take to answer this one as I turn it over to Pars.
Thank you, Jeff. So let's go ahead and let's take a look at this question now. Okay, so now we've got a 40-year-old male, and his presenting signs and symptoms are daily diarrhea. Okay, and we are also told that this is a chronic issue, past 5 months. Now, with these kinds of questions, when we talk about diarrhea and we talk about constipation and diarrhea, you want to find out information about the stool. In this case, they tell us it smelled worse, it is oily, he's been losing some weight even though he has a good appetite. Okay, now they do tell us some important medical history there. Okay, so we want to make note of that. Now this question is asking us about the initial test most likely to explain this patient's presentation. So I think we've got a couple steps here. I think, one, we've got to figure out what's going on in this patient, okay? And two, what would explain that presentation? And then I think you could make the argument that 3 would maybe be a test that kind of looks at that mechanism. So this could be a 3-step question. If you break it down, 1, again, what's going on in this patient. 2, what's the mechanism behind this presentation or this condition. And 3, what's a test that you could use based on that mechanism. You could also say what's a test that could diagnose this condition. It kind of depends a little bit on how they're going to ask us the question. So let's go ahead and let's take a look at those answer choices. And once again, we'll start at the bottom and work our way up to the top. Answer choice E, Sudan 3 staining. D, stool, ova, and parasite tests. C, serum lipase. B, colonoscopy. And A, anti-tissue transglutaminase IgA assay. So once again, we're going to go ahead and open up that poll. Go ahead and select what you think is the best answer here, and we'll talk about it in just a few seconds.
Okay, fantastic. Thank you, Paris. So let us know which of these tests is most likely going to explain this patient's presentation. Go ahead and make your selection. Looks like a lot of you have jumped in, and that's good. So again, make sure that you're kind of, thinking through this. You've gotten a few of the clues from Paras. Let's see here. So far, a little bit, almost half of you have voted, and again, we've got a clear favorite amongst the crowd. But we knew what happened in the last question, so that's we'll see if everyone is heading down the right path tonight. Okay, just about 3/4 of you have voted, so we're going to go ahead and close this poll, and let's share the results. And so once again, we've got an overwhelming favorite with serum lipase garnering over half of the votes. Sudan 3 staining in second place, anti-tissue transglutamase IgA in third place. Almost nobody thought colonoscopy, so there you go. Let's go ahead and hide the results and reveal the answer. And the answer for question 3 is answer choice E. So once again, kind of the dark horse here, or at least the number 2, Sudan 3 staining. It comes in and pulls off the upset. So again, looks like we're going to need to do a little bit of remediation. So Paras, can you help us out here?
Absolutely, Jeff. Yes, definitely a good GI question here to talk about. So what is going on here? Well, we were told that this patient is having some issues with diarrhea and also steatorrhea as well, okay, because of the oily stools, okay? So that tells us that this patient is not absorbing fat, okay? And what in this patient's history might be the cause of that? And that is, as told, probably the excessive alcohol use and the multiple bouts of acute pancreatitis. And this can cause your pancreas to not work well, pancreatic insufficiency, okay? Let's take a look at the next slide, and you can see that in this table in first aid that goes over these malabsorption syndromes, pancreatic insufficiency is one of them. You can see there at the very top that most malabsorption syndromes can cause diarrhea, steatorrhea, weight loss, okay? And you would screen for this test by testing if there's a lot of fat in the fecal material. And one of those stains is a Sudan stain that tests for fat, okay? And in this case, this patient most likely has malabsorption due to pancreatic insufficiency, due to chronic pancreatitis, okay? So it's important to keep in mind, in this question 1, this patient had malabsorption due to pancreatic insufficiency. And one of the ways to test for malabsorption is to check for fecal fat. So if we go back to our question, hopefully you guys can see now my answer choice E is the best answer. D, is a good thought to assess for a parasitic infection, but nothing really in the history to suggest that. Serum lipase would be used to diagnose acute pancreatitis, not chronic pancreatitis, okay? Answer choice B, colonoscopy, that would be to diagnose a structural issue of the colon, not so much malabsorption. And lastly, answer choice A, that would be checking for celiac disease, which can cause steatorrhea, but again, we have a better cause of what's causing the malabsorption with the chronic the multiple bouts of pancreatitis. So hopefully picked up a couple good important tips here on some malabsorption syndromes.
Excellent, thank you, Paras. So again, we've been covering a number of high yield and important areas here tonight. So hopefully you guys are all taking notes. We're going to get ready for our final question of the night. I do want to remind you we're going to have a raffle at the end of this evening session, and someone's going to walk out with a 3-month subscription to RX 360 Plus, which will help you get get started here in the new academic year. Want to remind you that if you're looking for a way to study on the go, the RX Bricks podcast is a great item to have in your, whether it's in your iTunes player or Spotify, whatever your podcast service of choice happens to be. We've got dozens of great podcasts that are all built around some of our most popular bricks. I think we've got a little over 140 that we've put in here, and all of these audio bricks usually take about 15-20 minutes, so easy to consume, especially if you're listening on at a faster speed. And it's just a great thing to have around if you're, heading to the gym or doing dishes or, taking a walk in the park. Again, a good way to review or even explore some topics that are new to you. So again, we've got the link there in the chat, absolutely free, the RX Bricks podcast. Okay, this is it. This is the final question for the night. Maybe it hasn't been a great night for you. It's okay. Sometimes we hit these subjects that you haven't studied in a while, or maybe you haven't studied at all. So this is a great night to get get the hard questions right, because we're here to learn, and there's certainly no shame in trying, right? So let's go ahead and open this up, and again, got all of those answer choices covered up. We do have an image for you to look at here, so let's look at the lead-in. Which of the following is the most likely etiology of this patient's symptoms? Okay, so you kind of know what you're going to be looking for as we read through the vignette. A 47-year-old man is being evaluated in the clinic for long-standing joint pain. The joint pain is migratory and involves the knees, wrists, and ankles. His rheumatoid factor test result was negative, and treatment for inflammatory arthritis did not help. Recently, he developed colicky abdominal pain associated with intermittent, greasy, foul-smelling diarrhea with a 5.4 kilogram weight loss over the past 3 weeks. An upper and lower gastrointestinal series with biopsy was performed. A photomicrograph of a jejunal biopsy specimen is shown. So again, the question, which of the following is the most likely etiology of this patient's symptoms? Paris?
Thank you, Jeff. So once again, we're going to go ahead and show you what we think are the important clues here. This is our 4th time doing that. So hopefully as you guys are starting to go through these GI questions, you know what things to look for in the vignette and the lead-in, and those important clues that you don't want to miss. As we talked about in a couple of the previous questions, there were a couple of very important clues there that really helped come to that diagnosis. So you don't want to miss those, and hopefully this was helpful in that regard as well. So now we've got a 47-year-old male, and he's coming in because of long-standing joint pain, okay? Now, anytime you have joint pain, you always want to ask about which joints, does it come and go? Is it always there? And they tell us a little bit about that, okay? And they tell us, he had some lab tests done, some treatments done, and they haven't really been helping, okay? But now they start talking about GI issues, abdominal pain, and some greasy, foul-smelling diarrhea with some weight loss, okay? So we're kind of getting a little bit of an overlap between MSK, rheumatology, and GI. So you want to start thinking about conditions that involve multiple systems like that, okay? And then they tell us a little bit about some workup that was done and a photomicrograph of a jejunal biopsy that's shown. So we're going to have to take a look at that. The question is asking us about the most likely etiology of the patient's symptoms. So I think we've, one, got to figure out what is going on here. What's the condition? What's going on with this patient? And then 2, what's the etiology? What's causing that to happen? So I think a nice 2-step question here. So let's go ahead and let's take a look at the next slide. I think it's a blow-up image of that jejunal biopsy, so you guys can take a closer look there, okay? We'll hover on this for a couple seconds, make sure you guys are getting a good look at what is going on here in this jejunum, and then we'll move on to the answer choices. And don't worry, that image is still going to be there in the bottom right. And once again, we will start at the bottom and we will work our way up to the top. Answer choice E, inflammatory response to dietary antigens. D, infection. C, chronic pancreatitis. B, brush border enzyme deficiency. And A, abusive over-the-counter medications. So we'll go ahead and open up that poll. Go ahead and select what you think is the best answer here, and we'll talk about it in just a few seconds.
Okay, thank you, Paris. So again, this is it. This is here in the cleanup spot. What do you think is the most likely etiology of this patient's symptoms? Had a good night of GI questions. Definitely challenging, but we'll see if you can close strong. And looks like we've got another question where we've got a answer choice that's kind of a clear favorite, but that's been misleading up to over the past couple of questions. So we'll be interested to see if it pans out or if people are making selections based on other evidence that that they're coming across. Okay. Let's see, 3/4 of you have voted, so I'm going to go ahead and close this poll, and let's go ahead and share the results. Okay, so a little under half of you went with answer choice E, inflammatory response to dietary antigens. I know that E has been the correct answer last couple of choices, so you know, maybe folks are playing the odds here. And in kind of a close to a tie for second in between infection and brush border enzyme deficiency. So let's see what the correct answer is. So I'm going to hide these results and reveal the answer. And the answer here for question number 4, answer choice D, infection, is the right response. So let's go ahead and turn it over to Pars, see what happened here. Pars?
Thank you, Jeff. Yes, definitely another tough question. So let's take a look at what's going on here, okay? Like we talked about, there's, a little bit of an overlap, some joint pain and also some GI symptoms. And kind of like the last case, a little bit of malabsorption. There's some fat in the stool. It's greasy, it's foul smelling, he's been losing weight, okay? And all of these things, especially when you factor in the joint pain, are suggestive of Whipple's disease, okay? And you can see in that image, as circled by that black circle or oval, you can see a lot of foam there, okay? Those are macrophages filled with fatty material, foamy material, okay? That's consistent with Whipple disease, where you see these foamy macrophages in the lamina propria, okay? Usually with Whipple's disease, and actually let's move on to the next slide. We'll kind of show you what first aid has to say about Whipple's disease. This is an infection with T. whipplei, okay? And you have these foamy macrophages in the lamina propria. And arthralgias are very common, okay? So in this patient, particularly when you factor in the arthralgia, as well as the malabsorption and the histologic findings, Whipple's disease is the best answer here. And this is caused by an infection with a gram-positive bacterium, okay? So let's go ahead and let's take a look at the other answer choices in case you selected that. I know a lot of people selected E. Once again, this is getting at a different malabsorption syndrome. This is getting at celiac sprue, okay? And that would show on a biopsy, that would show flattening of the villi as well as a lot of lymphocytes in the tissue. Not what we're seeing here. Answer choice C, chronic pancreatitis. That would be like our last patient. If the patient had a lot of bouts of pancreatitis, which this patient does not have. Answer choice B, brush border enzyme deficiency, that would be if the patient had, let's say, lactase deficiency and was unable to tolerate dairy. Not what we're told in the vignette, and also wouldn't explain the joint pain. Answer choice A, abuse of over-the-counter medications. That would be getting at if a patient were to be abusing laxatives, let's say. And what you would see is you would see dark discoloration in the colon on a colonoscopy or an endoscopy. So not what we're seeing here as well. So the best answer choice here is D. So great job on this GI questions tonight. I know we had some tough questions for you, but hopefully some good learning points that you guys were able to pick up on. And I will hand it back to you, Jeff.
Well, thank you, Paris. And yeah, I want to echo that. I think just as valuable as the questions are the explanations. And Paris did a nice job of walking you through these and helping you kind of differentiate between the answer choices and why those tricky distractors may have been incorrect. So again, hope you got a lot out of that. Let us know in the question box what your thoughts were on tonight's questions. If you want to review these questions, I'll give you a minute to screenshot the QIDs. If you've got a Step 1 QMax subscription, you could just go ahead and type these into RX Search, and you can dig into these at your leisure. A little bit more information regarding the content there, as well as the connections with all of the pages in First Aid.